Hello, we see you. Welcome to our show. It's We the Doctors. My name is Dr. Jules. This is the show where we help you understand health conditions in a light-hearted manner to help you make better healthcare choices. Today we're talking about a topic called glaucoma. I'm sure you've heard of it before. Glaucoma. And in the studio with me, of course, are my colleagues. We have Dr. Valeria.
Hi guys, you're welcome.
Dr. Yvonne.
Hello, you're welcome.
And Dr. Okay.
Welcome to today's show.
Yeah. So we're talking about glaucoma, and it is pretty common. Globally, we have 2 million people.
I think that thing is peculiar to Nigeria.
2 million people peculiar to Nigeria, to Nigerian environment, and it is very common. It's actually the second leading cause of blindness, right after cataract, and it kind of sneaks up on you, so to speak, because most people don't even know that they have this condition. And what basically is happening is there's a nerve in the eye, okay, that we call the optic nerve, that gets damaged, and that is what carries the message that for the brain to translate whatever you are seeing, okay? And it's very unfortunate, because this is one of those conditions that you can actually prevent if you detect it early enough. So let's talk about the risk factors first of all. Okay. And like we keep saying, risk factors, they don't really cause this condition. They are just predisposing factors or things that they've been found to be common amongst people that do suffer from this condition, okay? Absolutely. One of the things that I would like to talk about are people over 40. So definitely there's an age thing tied to this. Yeah. So if you are over 40 and of course you are in this environment.
Okay, they're talking about you. You're over 40.
I'm not over 40.
So I check your eye when I
can't pay him any mind, like really.
Oh my goodness.
This always happens. Dr. Wale finds me into the picture.
Why? He's always speaking on you.
You're our old friend. That's what I'm saying.
If you're over 40, you're watching us right now, you want to book that appointment to check out for this condition, which it can be easily prevented.
Yeah, and we also know that it's common amongst blacks as well. As in you find this case of glaucoma more in blacks.
Wait,
than
why
other
do you
races.
find all these illnesses in black? Every time we're doing something else.
No, that's what we say.
Studies anyway.
Or is it that the topics people are picking are the ones that are related to our environment?
No.
I need to understand.
First of all, we find things that are related to environment. But Dr. Valeria, it's about statistics.
Yeah. Exactly.
When you've checked this the figures.
Is it about lifestyle?
Figures do not
There's
lie.
so many things.
It's difficult to pinpoint that this is the cause, but it's been found to be in our environment. Like now, it's right for me to say that we're talking about Dr. Valeria. If I say it's found in black people,
Exactly.
I don't understand.
Because
and you talk to me.
Exactly. Since you are pushing to me. And anyway, let me just add this. There's a family history in glaucoma. You know, in many ways, because some people say glaucoma. I prefer to use glaucoma. It sounds like boom, glaucoma. So there's a family history associated with glaucoma. So when someone walks into the hospital and I begin to suspect, I want to ask, have you had someone that had a disease called glaucoma in your family? Sometimes they don't know.
They tell you that be glaucoma.
But we get it really.
Yeah.
So it's family. It doesn't mean because your father had it, you must have it.
Exactly.
Yes. But it means there's a tendency that you will have it.
Yeah, so
because even your granddad had it.
Even your siblings.
Yeah, does.
And I think one of all the
have
risk
your
factors on the more serious note now is trauma to the eyes. So if, like we said, we always talk about, you need to always protect your eyes. You know, after all, that's one of the reasons why you see some people wear glasses. Because, I mean, trauma to the eye, someone can punch you in the eye or can stab you in the eye or they can hit a ball at you in the eye, whichever way.
Or they can slap your face and they to hit your eye.
All
so
the
whichever one, any of those
them,
things
however.
can damage, you know, the optic nerve and then in turn can lead to glaucoma.
Exactly.
Then also prolong the use of steroids. Anyway, we'll get to that much later.
Exactly. And there are different ways people can present when they have this condition, okay? We have things like the basic one, pain. Pain in the eye. If you are lucky enough to even have it, because sometimes people
people
around,
don't even have symptoms.
it is when they start becoming blind that they realize that there's a problem.
Absolutely.
That is why we keep hammering on the importance
Routine
of a routine eye check. So please invest in that.
One way to even think about it is this. Imagine putting a pipe on this eye, another one on this eye.
Yeah.
You don't get to see anything.
Exactly.
And then you can imagine someone that is a driver driving that way.
Many people do drive like that. Yes.
You have
Many
to
people drive like that.
That's very interesting. It
Yeah.
brings me to something which is really important.
Eye
Comprehensive
testing,
eye
yes.
testing.
For drivers.
I think
Yes.
we should imbibe it in our culture. Before, a lot of people, some people don't even know how to drive. They have
Even
driver's
culture in
license.
the law.
Yes, that's what I'm saying.
So-
People
Right.
don't know how to drive. They have driver's license.
No, but these
How
days
about
we
when
do.
they
These days we
proper
do
eye
an
test
eye
and all
check
of that. It should
before.
be a thorough
It's
one.
actually compulsory now to do an eye test
Yeah.
before your driver's license is
Yeah.
granted.
Eye test.
In this
Then,
country, yeah, I did.
however,
before your
please,
driver's license is granted.
then as simple as redness of the eyes.
I did.
When your eyes look red, it might seem it's one of those things, and people start putting all sorts of eye drops
That they've kept in the house for some
Exactly.
time.
Please, you
Yeah.
might
There is one thing I want
be
to
looking
add.
towards
You know when we talk
direction.
about saints and ancient people and spiritual bodies, and when we draw their diagrams, there's this thing we put around their head. A
Hello, hello.
Yeah.
Uh-huh.
The easy way for me is just say hello. We put it around there. Now, when people begin to see visions of halos around people's head,
Yes.
don't mind my play of words, but that's what it sounds like to me. I want to start asking, are you developing glaucoma? Is it possible that I should check your eye when you come to the hospital? Tell me when you see somebody, see this circle around the person's head.
Exactly.
Everybody is now a
pinpoint
saint
it.
to you.
Exactly.
Yeah.
You can always start from your physician. If you don't know anywhere to go to, just see your doctor. He'll refer you to the right specialist. We'll take a quick break. When we come back, Dr. Yvonne will be helping us describe how this condition affects the individual in the first place. We, the doctors, will come back right after this. Do you suffer from heartburn? Doctor says you should avoid these 4 things: cigarettes, coffee, chocolate, and peppermint. They relax the opening of the esophagus where it meets the stomach. So the acid in the stomach can trigger more heartburn. Avoid these 4 things and you'll be in good shape. And that's what doctor says.
Coming up next.
Causes of this glaucoma. Dr. Ju said it earlier. She said it's the second leading cause of blindness. Then here, it is different from what we talked about before, because this kind of blindness is one way. Hi, welcome back. It's We the Doctors. We'll be talking about glaucoma. Very interesting topic, eh? Exactly. I'm Dr. Yvonne, and in this segment, we'll be talking about the causes of this glaucoma. Dr. Ju said it earlier. She said it's the second leading cause of blindness. Then here, it is different from what we talked about before, because this kind of blindness is one way. You can't come back once it has started happening. Exactly. So it's also known as the silent thief of vision. So it's important you know this because it's basically increased pressure in the eye. The same way we talk about high blood pressure. This one, I would like to call it high blood pressure in the eye. So that's the difference between...
High eye pressure.
I'll call it high blood pressure in the eyes.
Except when it happens without the pressure.
Yeah, however...
Exactly.
So what happens is this, basically, with this particular condition. In the front of the eye, that's the part you see, there's a liquid found around there called the aqueous humor. Normally, it flows. You don't know when these things happen, but they happen physiological anyway. It flows through a particular meshwork and goes unobstructed. But sometimes there are certain conditions that will cause some form of obstruction, preventing it from flowing the way it's meant to flow. So there's gradually a build-up. Normally, the eye is not supposed to be under such pressure. When there's this build-up, that's what leads to the pressure that we are talking about now. And you know the eye is very sensitive. Earlier on, we mentioned the optic nerve. If there's compression due to this pressure, which will, over time, lead to the damage of this optic nerve, you don't want to go there because the optic nerve is very sensitive. That's what actually takes information from the retina, which is where light passes through to, as in, takes the information from the retina to the brain. Then the brain now interprets this as the image you see when you're looking at someone, you're looking at something. However, if there's a damage to this optic nerve, then the person is blind.
Exactly.
Exactly. So there are many causes of glaucoma, which is this increase in pressure in the eyes that we'll be talking about now. So who's going first?
Before you talk about causes, I always like to hammer on statistics.
Okay.
So when people say causes, I often say, because everything in medicine is turning to genetics.
Right.
So once you ask me anything about cause of anything, I'm going to tell you genetics. So because we have familial incidences, I believe and I know that there are we have connections, genetic connection, familial connection to the cause of glaucoma. Okay. So I think I'll just pick it there before every other person decides to talk. Just let's always remember that there's a connection in your family.
Exactly. Then easy things like trauma, like you mentioned earlier. You're an Okada driver. Let me talk about the common one now. And you are driving morning. You know, most of those helmets, they have the protective
the visor.
screen. It's there for a reason. And if you have one and it doesn't have that visor, please get the one that will protect your eye. Or you're a carpenter and then you are working with shavings all the time. Particles get into your eyes. It's very important you protect your eyes.
Even talking about that, even chemicals. Sometimes people don't know things they put in their eyes and all of that. It can damage the optic nerve.
Yes.
You know, apart from blunt injuries to the eyes.
I've had a patient come to tell me that he saw that his eyes was red and then he mixed this herb and then he had to leave the leaf in the eye overnight and stuff like that. I'm not condemning the practice, but I'm like, where's the proof? As in, if there's no scientific backing to whatever.
That's also
if I say I'm
children.
condemning the practice, will I be wrong? Because I believe such practices must be scientific.
Yes.
If you don't have any scientific base,
exactly,
then stand out and condemn the practice.
Don't do it. Scientific backing,
don't do it.
Don't do it. That is what I would say.
Don't do it.
You don't know people who come out and prove that, oh, this is working for me.
When it's proven, I'm fine.
Exactly. When
it's proven and reproducible, I'm
fine.
But
I cannot
once
defend that for you.
Another thing is, still talking about blunt injury and chemical injuries to the eyes. You realize that there are some things that you buy in the house that are supposed to be corrosive, so to say. You realize that they put on it and said the eye should not be taken near it. And then children don't know some of this thing. They spray them into their eyes and all of that. So you need to be very, very careful.
Or if females are actually more at risk for glaucoma. I know Dr. Valeria is happy to hear that. Females are actually more at risk for glaucoma than the males. Anyway, these are many more causes that we've been talking about. So we'll be right back
You're
very
branding
soon.
me the wrong way.
Don't go anywhere.
Hello and welcome back to the show. You are still watching We the Doctors. My name is Dr. OK. For today's interview, we are at the Eye Doctors and we are still discussing our topic, glaucoma. What are we going to do in the Eye Doctors today? We're going to be discussing with a consultant ophthalmologist, Dr. Abiola Oyeleye, who is going to take us through questions that you've been asking us on the show, and we'll get him to answer them for you, straight from the horse's mouth, as we say. Dr. Abiola, welcome to our show today.
Thank you very much. Thank you for having me.
So, our topic is glaucoma. And basically, the common thing people ask is, can it be prevented? So I want to find out from you, can it be prevented?
Thank you very much. Let me hit the nail on the head straight away. Glaucoma cannot be prevented. Glaucoma cannot be cured. However, it can be treated and treated successfully so that the glaucoma doesn't get worse. Glaucoma is called the silent thief of sight. The silent thief of sight. And it's gotten that name because you could have glaucoma, you don't know you have glaucoma, and you start losing your sight gradually. Usually it's the peripheral vision, the vision on the outside you start losing. So you might have somebody in front of you, you see the person, but things around, you don't see them. And you still believe you can see. And if someone asks you, oh, what's your vision like? You say, I can see a mile in front of me. But that doesn't mean all is well. So it's called the silent thief of sight. The way you can diagnose glaucoma is simple. Have an eye test. Okay. You cannot diagnose glaucoma without having an eye test. At the eye test, what the eye care professional, that's the ophthalmologist or the optometrist, what they will do is to first of all find out whether you can see well in the distance, whether you can see well on your sides. This might be using various tests like the visual field analysis, which you had done and was normal.
Yeah.
They'll also check the pressure in your eye, because pressure is what we call the #1 risk factor in glaucoma. So they'll check the pressure in your eye. It doesn't mean that if your pressure is normal, you don't have glaucoma, because you can have glaucoma with normal pressures. You may even have pressures that are raised slightly and not have glaucoma. So the story of glaucoma doesn't end with pressures. Like I said, you have your pressures checked, you have your visual field test done to see how well you can see in front and on the side. And then you have what we call an internal eye examination. They look at the nerve of the eye because glaucoma is a disease of the optic nerve. Yeah. Like you know, the optic nerve carries all the information from the eye to the brain. If the optic nerve is damaged, there is nothing to carry the information if it's completely damaged. If it's slightly damaged, some information will be carried, but not all the information. So we must look at the optic nerve, which is called a fundoscopy. There are other more sophisticated tests, but for the purpose of this program, let us just stop at those tests which will identify whether or not you have glaucoma or you're at risk of getting glaucoma.
Okay, so since you said glaucoma cannot be prevented and glaucoma cannot be treated.
It can be treated.
Okay.
It cannot be cured.
It cannot be cured.
It can be treated successfully. That means that you do not deteriorate.
Yes.
If you've lost 50% of your vision before you get diagnosed and you start treatment, the 50% you've lost, you will never get it back. Yes. The job of the ophthalmologist now is to stop you losing the other 50%.
Okay, so what are our treatment options?
Very good. Now, before we go to the treatment options, I'll just mention family history.
Yeah.
Like I asked you, do you have any member of your family with glaucoma? If you do, you are more likely to get glaucoma than somebody who does not have glaucoma in their family.
But Dr. Abiola, in our environment, most people don't know.
So we ask them, do you have any family history of blindness?
And we don't keep good family trees.
Yeah, but some people know that, oh, my father was blind before he died.
That's true.
Because it could be glaucoma, it may not be glaucoma. But we should ask the question, because sometimes people know, and it actually puts us in line.
Yes.
Like and when you diagnose glaucoma, you ask them, your brothers, your sisters, and your children above the age of 30 should have be tested for glaucoma. If you're in the UK, where there is a white population, they say above the age of 40. But when you have an African population, like here in the United States of America, where you have a lot of Africans, you move that to the age of 30. The reason is, first of all, glaucoma is said to be a bit more aggressive in the black race, and treatment is less successful in the black race. So we want you to catch it earlier. That's why we say 30 for the blacks. Now, the treatment options, there are mainly 3 treatment options. Number 1, medication. Number 2, laser. Number 3, surgery. Medication is mostly eye drops, but you do have some tablets that help as well, but mostly eye drops. And what do the drops do? They mainly bring down the pressure in the eye. Your pressure is usually monitored on a regular basis. But it's important to know what the first pressure was when the diagnosis was made, and then the effect of the medication. Some people use 1 type of medication, some 2, some 3, and medication is expensive.
So, let me interrupt, please. It's important to mention that these are not medications that the chemist, as we find on the street, will give you. It must come from your ophthalmologist.
It should come from the ophthalmologist. However, in Nigeria, you don't need a prescription for most things, and they go to the chemist and they say, oh, let me have this certain drug. Some pharmacists will actually tell you, why are you using this drug? Was it prescribed by a doctor and things like that? And they say, okay, it wasn't prescribed by a doctor, go to your doctor. Some will say, this is it. After medication, laser, after laser, surgery. Laser is not very commonly used in Nigeria, but it does have good results. Surgery, when it's done, it could bring the pressure down quite low to what we want it to do. However, after a few years, the pressure can build up again. So you still need to be under review even though you've had surgery. You could have surgery and they say, okay, we still want to maintain you on some drops. So these are various modalities of treatment. So like I said, medication, laser, or surgery.
Dr. Abiola, thank you very much for today's interview. It's been wonderful and enlightening for our audience. If you are just joining us, what you just saw was an interview with Dr. Abiola Oyeleye at the Eye Doctors here in Victoria Island, Lagos. And just keep watching the show. When we come back, we'll open up with Dr. Valeria giving us tips on what to do when you've been diagnosed with glaucoma.
Could I just slip in one little thing before we close? That everybody should go and get an eye test and ask specifically, can I have a test for glaucoma? An eye test is not just about getting glasses to see better. Ask the eye care practitioner, can I have a test for glaucoma? That's the take-home message.
Right. Wow. Thank you, Dr. Abiola, for today's interview. We, the doctors, will be right back.
Hello and you're welcome back. If you're just joining us, this is We the Doctors. My name is Dr. Valeria. We have been talking about glaucoma, and we talked earlier and I said that it's the second leading cause of irreversible blindness to the eye. So it's very important for you to know about this and know about ways to prevent this from happening to you. All right, we've talked about the family history being a predisposing factor. We talked about age being one of the predisposing factors. And these are things that are not modifiable. You can't change your family. You can't even change your age. You can't say, I'm 14, I want to become 12.
True.
All right, so these are things that can predispose you to it, amongst other things, you know. And then, so at this point in time, we'll be telling you about ways that you can prevent, you know, having glaucoma.
Okay,
Yeah,
you have to avoid trauma to the eyes, basically.
Yes.
Like Dr. I don't know, maybe you should develop some new judo skills, block the
avoid as much
whatever.
as possible, because there are times you can avoid trauma.
I understand.
Eyes,
yes.
But as much as you can avoid
exactly,
trauma.
especially if you are going to be in an environment for a long period of time and you know you'll be exposed to certain will I say particles or environmental factors that can affect your eye. You want to invest in goggles or the better headgear. You talked about the visor with the helmet, your Okada riders. There are so many other things.
Welders, the occupations.
See your doctor to give you the anti-reflective glasses.
Have you seen children playing this game? Slap me, I slap you.
Oh my goodness.
So how do you
stay away from games that would
how do you avoid such trauma?
Where are your glasses, by the way? He wears glasses, by the way. Where are your glasses?
Then again, prompt treatment of any form of inflammation, like the case of blunt trauma. So many, you want to get your eyes checked.
Or you pour something into your eyes, the corrosive equipment, and then you have to quickly,
secondary causes of
glaucoma. All right, so that's about what you've heard about ways and many more to prevent glaucoma. Remember, glaucoma, we said, is a sneak thief of the vision, meaning that it just happens, you know, abruptly, so to say. Before you know it, the intraocular pressure keeps building up, and before you know it, the sight is gone. Exactly. All right, so that's why it is very, very, very important that you do a comprehensive eye check. Exactly. All right, because if you check your eye early enough, if you detect this thing early enough, it can prevent what's that?
Blindness.
It can prevent blindness.
Doctor, okay, what questions do we have from our social media?
Today from our social media questions, really this didn't come in from the social media. It came as a direct mail to us. He doesn't want his name revealed, so I'm not going to reveal it. It's really, and it's a long one, so I'm going to just give you a summary of the question. This man has a mom going for surgeries for glaucoma. I don't know what form of surgery, whether it's laser or normal regular surgery for glaucoma. But his concern now is that the mom is meant to have surgery in both eyes. And he says the doctor says that the surgery will not be done on the same day. That's how he sent in the mail. And I think the doctor is right.
Exactly.
Really, because we like to space these surgeries by 6 weeks. Oftentimes by 6 weeks. The ophthalmology managing will let you know how much space you should give. But there are many reasons for that. You don't want your mom coming out with patches on both eyes, really. It doesn't look nice. And then for some reasons, you want to see how has improvement on this eye gone before you go in for another surgery. I think it's just...
And besides, and they're going to cover that eye for about 6 weeks. So you can imagine her living without her vision for 6 weeks. If they do them together, that would be quite cumbersome.
But what I'm considering is, what I'm wondering is, that's the question we're going to find out later, and then we'll discuss with them on social media platform is, if one eye, due to glaucoma, has lost much vision, and the other one has, let's say this has lost 60%, and this has just lost 20, which do you want to do first?
Well, you have to do the one that has lost most vision first, because the person, like we said, the person will have to stay without vision for a long time.
Okay. What about trying to protect the one that has lost 20?
Absolutely.
Yeah.
And because knowing that you can
thing-
quickly get that back, right?
No,
Well,
no, I don't
well,
understand what
No,
you're
I'm
saying.
saying, you know, in glaucoma, let's say this eye has lost 60%.
Yes.
And the other eye has lost 20.
Yeah, exactly.
But you have to do surgery for both eyes. Which would you prefer to do first?
The one that has
She
lost
already
most
said it,
vision.
most vision.
Which one has the better prognosis?
The better prognosis is the one with
However,
20%.
20%. So if I do the 60% one, and at the end of the day, nothing comes out of it, I'd rather deal with this early
Because
enough.
if I do with the 60%,
Yes.
you can only see 40% eventually after the surgery.
Okay, the prognosis
But
is
this one
shorter.
has lost just 20%.
But you do it one by one now.
Yeah, but what we are
Hey,
saying
do
now, which one will you
which
pick
one
first?
would you do first? It's just...
No, it's the fact that you do the one
You
with
should have asked
more
the
whatever
ophthalmologist.
first
You know,
doesn't mean that you will get blind.
Yeah.
Wait, the fact that you have to do that one first doesn't mean that you will now get blind in 2 months' time because of the next one. Do you know for how long the progression, this
Now,
thing has been
that's-
before the blindness
Let me
even
explain.
started?
think
The reason I ask this question
Learn for the
is-
ophthalmologist
Yeah,
to
the reason I ask
decide.
this question is just to help explain to him
Yes.
that oftentimes the ophthalmologist managing you that takes the decision.
Absolutely.
Because there are no hard rules on things like
Absolutely.
this. You saw the way we all arguing, and
Yes.
she has her reasons, good reasons. I have my good reasons. You have your good reasons. And for the first time, I'm with Dr. Valeria on the same side.
Hallelujah.
Let's stand for the truth. That's all.
So we thank God that peace reigned on today's episode. We've been talking about glaucoma.
Glaucoma, my-
Glaucoma. Oh my goodness. My tongue is different from yours, obviously. But that is our show for today.
Yeah.
So definitely, if you don't take anything out of everything that we've said, you definitely want to do your comprehensive eye check early enough and let the decision, anything that has to do with the eye, the definitive decision should come from your ophthalmologist. Okay, so that is it for today. More episodes, you can watch them on YouTube. Just search for We the Doctors and follow us on Twitter at We the Doctors. From myself and my colleagues, we're saying bye-bye.
Stay
and
healthy.
Stay healthy.